You served as the Federal Chief Environmental Justice Officer at the White House Council on Environmental Quality in the previous administration. We're here talking about health and health disparities. What does policy have to do with it? Specifically, how are environmental policies shaping maternal health outcomes and health disparities?
I appreciate that question. And I mean, the importance of policy is that they're put in place to protect people, to help us tackle really critical issues. And when you talk about maternal and child health, it's so connected to so many different things. It's environmental quality, it's access to health care, it's making sure that we have the right and enough funded research to untangle those questions that we can then begin to address. So policy is part of the solution set to actually advancing maternal and child health. But you have to have good policy because we've seen the impacts of bad policy in the past. And when I say good policy, what that means is making sure that it is informed by communities that have been impacted by that situation. Yeah. So it's moms and children that have had to deal with asthma, that have had preterm births. What is it that they need, or what is it that was missing that kept them from having that healthy birth outcome or being able to live, again, a quality of life that we all deserve. So policy is a major piece of the puzzle.
Yeah, and you have long advocated for both science and communities informing policy, right? Sometimes the science alone isn't enough, and we need to hear what's happening on the ground, not only so that we have a better scientific understanding of what's happening, but to help influence our lawmakers and make these issues more personal to them.